Hello and welcome to World Bank Live. I'm Paul Lake, and we've got a very interesting program lined up for you today, all about the impact of the coronavirus pandemic on women and girls. This is just the latest in our ongoing series examining the ways in which the pandemic is affecting global development. But before we jump into today's discussion, I want to just play for you a quick film produced by our multimedia team about the moment we're living in.
We are separated when we need each other the most. We stay apart to protect one another. But we are also coming together in new ways to show appreciation. To inspire. To rally together to help the vulnerable and those on the front lines. As with people, countries must come together too, to help the poorest and most vulnerable, and those in societies on the brink or in the throes of conflict, to help those least able to respond. The World Bank Group is proud to be part of an international response to the coronavirus pandemic. We will deploy up to $160 billion over the next 15 months to help countries with the greatest need, to strengthen health systems, to increase surveillance on the disease, to help companies continue to operate and workers to keep their jobs, to speed the time to recovery, and to prepare for when we can close the distance between us. Together, we can make a difference. Together, we can achieve results that change lives. Learn more about the World Bank Group's response to the coronavirus pandemic.
Well, as you saw there, the World Bank Group is looking to address the impact of COVID-19 on a variety of fronts. And one of the key issues is its impact on women and girls. To learn more about the gender dynamics of this pandemic and what the Bank Group is doing to help, I'm very happy to be joined today by the World Bank's Global Director for Gender, Karen Groen. Karen, thank you so much for being here.
Thank you so much for having me.
Well, let's jump right into it. I've got a big question for you. Some might be wondering, people who are tuning into this, they might be wondering why the need to consider the impact of this virus, the pandemic, on women and girls as a distinct issue, a distinct question, separate to the population as a whole.
Well, it turns out actually that the pandemic is not gender neutral, as I would say. It actually has differential impacts on men and on women and on boys and girls. As a result of a number of factors in terms of their biology and physiology, but also because of their social and economic roles in the different societies in which they live. And I think therefore the responses, when we think about the policy response and the sectoral response, we also have to not be gender neutral. We have to actually tailor responses to address the very different vulnerabilities, but also the very different agency roles that men and women can play. I don't know if you want me to continue, but the work that we've been doing on this, there are really 4 channels of impact. So the first is really through health conditions and health behaviors. A lot of people have probably heard that men have higher mortality and there's higher male fatalities in the pandemic than female fatalities. And that's absolutely the case. And there's a lot of discussion right now in the literature about whether that's due to physiology, hormonal, other issues, or whether it's due to social issues. The fact that men in many countries have higher smoking rates.
A lot of the research is still being developed is what you're saying there.
Yeah, so exactly. But I have to say that even though we think that mortality might be a male issue, it has consequences for women. Why? Because men earn And in those households where men have perished, there may need to be income earning opportunities for women or ability to access cash transfers or pensions.
So just to make sure I'm understanding what you're saying there is in households where the men are the kind of primary earner, the primary breadwinner, if the women do
not. Even if they're not the primary breadwinner, it could be, the fact is that one source of income is suddenly gone, and that income will need to be replaced for household survival and for households to be able to cope with the pandemic. And it may also be that women's caregiving roles actually increase as a result of that. But there's another set of issues in the health sector that I think are really important, which is that, two sets of issues. The first is that more women than men around the world are in the front lines of the healthcare profession as nurses, as physician assistants, as other frontline workers. In some countries, it's as high as 85 to 90%. So what that means is women are at greater risk of exposure overall than men. And it turns out when you look at the data, there's higher morbidity. There's more women who are infected in the healthcare sector than are men. And then the third issue around health is really, really important, which is that pandemics and crises put tremendous pressure on systems. And it means that services are stretched and capacity may be really thin. And so women have ongoing needs for maternal and reproductive health care, and those services may be difficult to continue in times of crisis. Or it may be that with lockdowns and shutdowns, women may be unable to move around to get to those kinds of services. So there's all kinds of effects on the health channel, through the health channel, that we need to think about. But there's also other channels through education and economic pathways that we could talk about.
I was going to say, let's dive right into that. The very next question I wanted to ask you about was that education angle. The bank has worked at securing access to schooling for girls, and we've seen a huge improvement in that over recent years. Are you concerned that this pandemic could, somehow reverse that process, that progress, and how could that, what would that look like, that reversal? And then I would just add one more thing to that, which is how can, governments and institutions respond to that?
So that's also a really good question. And I am really concerned that this is a big risk in several of the countries where the bank works, in the lower income countries, in the lower middle income countries, even in the higher income countries. And the reasons I'm concerned is that in previous crises, what we've learned from Ebola or SARS or H1N1 is that sometimes girls don't return to school. And that would be a real problem. But there are a number of issues there. The first is that school closures and economic necessity can lead boys and girls to drop out. And depending on what they do, the experience from previous crises is that boys go back quicker and some girls just don't return, either because they're in the labor market or because they have caregiving responsibilities. There's one other issue, I think, with respect to issues like distance learning, which many countries are now trying to provide. In many countries, there's a digital divide where boys have greater access to the internet. They might actually monopolize the one computer that's in a poor household's home. And if that's the case, it means that boys may be prioritized over girls in terms of having greater access to learning materials. So it means that girls may actually fall behind in terms of learning opportunities and learning outcomes. And these are things that we really need to pay attention to. And also because care is disrupted with school, often it's older girls who have to care for younger siblings. Those caregiving responsibilities may trump their ability to actually go online for scheduled classes and doing those kinds of things. So there are very real risks there. And we know that there are actually ways to get around that, including using social messaging about the importance of girls continuing in school. There may be ways that we can bundle services. For instance, we've been talking about enhancing digital approaches. Well, maybe we can actually give more as part of our approaches to register households and so forth, actually provide them with low-cost technology so that girls have their own technology. It's not just one per household. So there's things like that that we could be thinking of.
And I have a bunch of questions for you coming up about solutions and that sort of thing, but it's fascinating that confluence of digital divide, gender divide, somewhat becoming a sort of education.
And it's basically norms as well. I think during pandemics, we revert back into standard established norms, and that becomes really difficult to overcome. But there's one more point that I know you're going to ask me about, but I'm going to preempt you, which is to say that the economic channel is hugely important, and I do want to spend some time. You may have seen that there was a Washington Post headline, even in the United States, that said that not only is this a public health crisis, but it is an economic crisis. And these are crises that are going hand in hand in most countries. In the US, but in other countries as well, the headline of the Washington Post was, as this country goes into recession, we should maybe start to call it a she-cession.
Karen, I want to ask you about the economic crisis, but let's take a quick moment to welcome everyone who is joining us from around the world. You're with World Bank Live, and today we're talking to Karen Groen. She's the Global Director for Gender here at the World Bank Group. Karen's been talking us through the impacts of the coronavirus pandemic on specifically women and girls. And Karen, just before the break, and I'm sorry to interrupt you there, you were talking about the economics of this and how the pandemic, as it potentially pushes the world into recession, how that can particularly affect women. Could you just pick up where you left off?
I was starting to say that actually because of where women are placed in the economy relative to men, there may be greater differential impacts on women than on men. And I was just noting that in the US, the headline of a recent Washington Post article was that we should name this a she-cession as opposed to a recession. And the reason they say that is because the jobs in the sectors where women predominate are the ones that are first and hardest hit. Think hospitality, think health services. Actually, there's even job losses in health services, even as the demand for health services goes up. Think retail, restaurants, stores, other kinds of retail establishments, much of the services. And those jobs have rapidly been lost in many countries around the world. In some countries, there are other sectors that are particularly hard hit. For instance, the garment industry, which is a manufacturing industry, has lost many thousands of employees in countries like Cambodia and Vietnam and Bangladesh. And women are the backbone labor force of those industries. So what this means is not just higher unemployment, but lack of income and ability to cope. The other thing about the labor force that I think is really important is that around the world, women predominate in informal employment. These are the types of jobs that don't come with fringe benefits like social protection and health insurance and unemployment compensation and all the benefits that people who work in formal jobs take for granted.
And I imagine that makes it harder to reach them with kind of relief efforts and stimulus efforts as well.
Absolutely. Makes it much harder. So think people like domestic workers, people who clean people's homes, or think about street vendors, or think about waste pickers. In many countries, for instance, in India, there are people who go and pick through waste dumps to recycle things, and they sell that. So those are really, really hard hit, particularly with lockdowns and shutdowns in the economy without compensation. So the informality is particularly important, and a solution, which I know we'll come to, is to really think about how we extend social protection programs, particularly cash transfers, to those groups of workers. And there's two final things I would say. Agriculture is a very feminized sector, and agriculture is also hit very hard right now. There are big disruptions in market conditions and supply chains, and it's really important that we keep the food supply moving. But it's very difficult in these conditions, and that affects female smallholders relative to others because they have fewer resources to help them cope in terms of harvesting, in terms of hiring labor, other kinds of things that are really critical.
And potentially impacting food security in vulnerable.
Potentially impacting food security. And the final thing that I think is the invisible part, although I think it's very visible right now, invisible because it's not counted, is in the increased demands for caregiving as a result of, one, job loss, as a result of school closures, as a result of just taking care of the enormous number of people who are sick and require care. And often care falls to women. Care of children, care of the people who are sick, care of the elderly. So those caregiving demands have substantially increased, and we don't have
to say they've sort of multiplied as a result of
totally, and it's invisible, it's unpaid, it's uncounted, but that causes enormous stress, and it causes, I think, disruptions. You know, I have to say, even though we're a very privileged group at the World Bank, the hardest thing I think for people right now who work at the bank is juggling caregiving for children and work.
So I heard that. Colleagues, and as you said, you know, we're a lucky group compared to a lot of people around the world.
Yeah. So, but I think that, again, when we get to the solutions, support for care, social support for care is going to be extremely important. And there's one other pandemic that we see that existed before the crisis and has been exacerbated by this crisis. And that is the increases in intimate partner violence around the world. Shutdowns, lockdowns, lack of mobility mean that people are indoors in cramped conditions. So there can be stress. People don't necessarily have conflict management skills. And in the countries that UN Women and the WHO and the bank have been tracking, we actually see increases to those helplines and to those services that are still going, increases in calls from women. And the increases in calls, and these are largely women as opposed to men, can have spiked by anywhere from 30 to 60% from before the pandemic. So already we know that gender-based violence, intimate partner violence, affects 1 in 3 women around the world. And so in this situation right now, it's even more imperative to continue to provide the services that women need, particularly the frontline health services that they might need to access, the referral services to psychosocial support and counselors, and they may need other services like legal services or livelihood services or other services that we just have to keep going. And it's fantastic because the UN Secretary General did recognize a few weeks ago that services for survivors of gender-based violence should be considered part of the essential package of emergency services that gets delivered.
So Karen, you know, we've been talking for a few minutes now, and we've laid out a fairly bleak picture of how COVID-19 is impacting women and girls, especially, you know, more hard around the world during the pandemic. I want to turn now to solutions a little bit, but let's just take a quick moment to welcome people who are joining us from around the world. This is World Bank Live. We've got Global Director for Gender, Karen Groen. She's here at the World Bank Group, and she's talking us through the impacts of COVID-19 on women and girls around the world. But I wanted to turn to solutions now, and you've talked a little bit about them on a kind of topic by topic basis so far, but I was wondering if you could just kind of give us a broader overview, you know, if governments, if institutions are coming to you for advice, what sort of solutions should they be looking at? What sort of response should they be looking at to try to head off some of these concerns that you've been raising over the past few minutes?
I think there's really 4 sort of big buckets of response through which the actions that we take in each of them really need to pay attention to the different ways that the pandemic impacts men and women. So the first is saving lives. You know, that's really critical. We need to save lives. We need to take all of the social distancing measures. We need to ensure that people have personal protective equipment and all of that. But part of that also means that we need to pay attention to females as the frontline caregivers. We need to reduce their risk of exposure by ensuring that they have the right equipment and the right resources. We need to ensure that women can access health services, and we need to ensure that certain services just are essential and keep going. So as a government who's thinking about a health response, I would say to them, please do not divert funding from your maternal and reproductive and child health programming. That is just essential. There may be other things to cut in terms of capital expenditures, but these are really essential for your populations. The second response is really protecting the poor and protecting those who are most vulnerable. And I talked earlier about the fact that women largely predominate as informal workers. They're in very insecure sectors and in insecure jobs. Here, I think it's really important that countries expand their cash transfer programs, their social safety net programs, their social pensions and other things. But it's expanding in a different way. It's incorporating workers who are vulnerable, like street vendors and domestic workers and beedi rollers in India, piece workers, into this net. So it might be trying to bring them into the social registry, but it might mean reaching them through community-based organizations, women's organizations. And I'll give you one example. For instance, Seva in India has really responded in this crisis. It's the largest trade union of informally employed women around the world. And this trade union is mobilizing at the community level to do things like rejigger activities to provide food and milk to very poor households. And they've established an incredible network of food provision and support. Others who are seamstresses are now making masks, for instance, and turning that into a livelihood activity for local governments who need to procure them for their workers. So it's not just the cash transfers, it's also figuring out how we can help people preserve their jobs and their livelihoods and can, in a sense, rebuild back better. And on the firm side, there's many things. We're hearing from many women-owned firms who are smaller, who have less access to capital, who have less networks than male-owned firms, that they need things too. So we've been having conversations, for instance, with banks about suspending interest rate payments or deferring payments, offering services to women-owned firms to help them figure out how to be more resilient with inventory planning. There may be support for women-owned firms in terms of rent deferrals or payments of utility bills, many things that could be done. So that's the second bucket. The third bucket is really what I call building back better. And I love a quote. I don't remember who mentioned it, but this was a quote from one of the crises, the economic crises we had in the 1990s. Never waste a crisis. We can use the crisis to take the opportunity to build back better. So how do we build back better? It's strengthening the systems, the social protection systems. It's strengthening the financial system. And the checks and balances and ensuring liquidity, better bankruptcy regulations, for instance. It's building back better in the sense of having a stronger framework for care, the caregiving that I mentioned, whether it's at the community level or whether it's what employers provide or whether it's what the government subsidizes. These are just essential. And if we don't include those things in the building back better, we're never going to be able to take advantage of the opportunity of women's ability to participate in the labor force and contribute to the economy, which we know is so essential for productivity and growth. So let's build back better with a response that also incorporates the kinds of things that women need. And that's where the care issues and I think also the women's agency and decision making. In the first round of the crisis, who did you see on the TV screens? Mostly men. Women need to be represented in crisis management, in decision making, in planning, in messaging. So we need women's leadership around the world, not just at the national level, but at the local level in building back better and managing this crisis.
Well, Karen, this has been really interesting. Thank you so much for taking your time. I know you got a really busy schedule, so we really appreciate you taking the time to talk to us today.
Well, I hope everybody will join in these efforts. Let's roll up our sleeves. And my final word would be, let's not make this business as usual. Let's make this a business unusual response and make sure that outcomes work for everyone, men, women, girls, and boys.
It's a great sentiment. Karen Groen is the Global Director for Gender here at the World Bank Group. And thank you for tuning in wherever you are. As I said at the top of the show, this is just the latest episode in our ongoing series examining the effects of COVID-19 on global development. If you missed any of the previous episodes, or if you want to rewatch this episode, head on over to live.worldbank.org. Next week, we'll be asking how we can ensure a sustainable recovery, a topic that will become ever more important as the world looks to rebuild and build back better, as Karen Groen was just telling us there, after this pandemic passes. So I hope you'll join us for that. In the meantime, to learn more about the World Bank's response to the pandemic, you can head on over to worldbank.org/coronavirus. Until next time, stay healthy, stay safe. We'll see you here again soon. Goodbye.